thing that we start to talk about is what are our rights and what are our responsibilities. Views of rights and responsibilities. And because we are nurses, we have a lot to do with rights. Now, being a good nurse is not just fighting to keep the patient alive. It's not just fighting to keep the patient healthy. It's not just fighting to do the love of your job. It's equally fighting to not be in jail. Because we are dealing directly with human beings. They are not furnitures. It's not food that you can make an error and then you cook another one and the story is solved. It's not a furniture where it can be broken, you can have a man, you might not create the shape that the customer wants, and then you go back, do the corrections, and everything is solved. With a human being, if you make an error, the individual dies. Point final. Sorry? You are not singing. So, as nurses, if you have made an error, immediately you make an error with someone, bye-bye, the individual goes. Now you will start having the right to explain to the court what happened. Was it something you did? Was it something you did not do? Does it mean that each time a human being dies or each time a person dies under the care of a nurse, we have got to go to jail or go to court to answer questions? No. But scenarios might happen that it will be evidence enough that something went wrong. Let's say in a situation where your patient is hypoglycemic and you do not assess to identify what is wrong, you go ahead to give insulin and then the patient goes, what do you think will happen? It's an error that you did. Is that true? So they will have a problem with that. Let's say that you are in the hospital and a patient is hyperglycemic and then was rushed to the hospital and you took D20, D5 and you say, what will happen? The patient will not be, they will not have a term for it. And the patient will pass away. You did it. And believe me, if they have to be assessing and checking and verifying what happened, what does not happen, half of the nurses will be in jail. You will be going home and everything that happens to the patient, you will be the one to be questioned. If you are in the hospital, there is a team to be questioned. Because it is not just the responsibility of one person. Even though in the hospital, the patient will be assigned to a nurse. And the nurse is responsible in answering the immediate questions that happens. What happens to the patient at that moment? But there is a whole team that is together in making sure that this patient is okay. Are you understanding? So long as you're a nurse, we start talking of bills of rights. What are my rights? What is my do and what is my do not? As well as the responsibilities that you have to perform. One, learning objective. In this course, we will explain each patient's rights and responsibilities, and that is why we will say in nursing that for every right that the patient has, it's the responsibility of the nurse to achieve that right. If the patient has right to respect, who is the one to respect the patient? The nurse. it becomes the responsibility of the nurse to respect the patient. If the patient has the right for autonomy, who is the one to make sure that the patient's autonomy is respected? The nurse. If the patient has the right for care and administration and medication administration, who is the one to perform those responsibilities? The nurse. So for every right of a patient, there is a responsibility that is supposed to be carried out by the nurse. Next, understand the need to know each right and the responsibility. What are all the rights of the patient? And for those rights, what are the responsibilities to be carried out by the nurse? Next, ensure all rights and responsibilities are adhered to and applied into practice during care delivery. So you ensure that all the rights that have been mentioned are applied to during care delivery. Now, definition, what is the patient's right according to you? Tell me. Because this other course is nothing new, it's what you've been doing all through.
Patients have rights to refuse, patients have rights to educate, patient has rights to know about the treatment.
Go ahead.
Patient have rights to get knowledge about the condition.
They have the rights to be knowledgeable about their own condition, correct?
Patient have rights to refuse.
Yes, patients have rights to refuse their medications, refuse treatment combined. And that is why do not resuscitate is approved here. It is not approved in my own country. If the law does not call you, you cannot approve not to live. In my own country, you will live whether you like it or not. Except you are called by the Lord. That is it. If not, it is a crime not to save somebody's life. But here it is. In the Europe it is. In America there is. Do not resuscitate. And we have one. Definition of patient's right. We have policies and rules that must be preserved and protected by the health care, by you, the nurse, to do what? To facilitate towards patient and family care. You are not just to respect the patient and their rights, you are equally going to go ahead and one step further to respect the family and what they want to be incorporated. Because you meet palliative care patients who cannot speak, who cannot do anything on their own. You usually meet bedridden patients who cannot speak, and the family will be standing to cover the gap. The family will be there to say, you know what, this is what we want for mama, this is what we don't want for mama, this is how you are going to act, this is what you are going to do, this is when you will do it. And you will incorporate what they want into your care. Next, right and, okay, now you can identify. The first right we have is, 1, the right, respectful care. You have the right as the nurse to give the patient respectful care. I am going to give you food, not just serve you food as though you're a beggar, not just serve you food as though I am now the Jesus that is coming into the life of the patient, not serve food to the patient as though now I am the everything. I will be humble, I will be respectful, I will be nice, and I will serve food to the patient as a human being that should be treated as such. Even if they are completely palliative and they cannot see, speak, or do anything, you still respect them. Okay. Next, we have patients have the right to receive treatment by a licensed nurse in a licensed facility. So since we are nurses that will be taking care of patients at home, we cannot send you to the patient if you are not licensed. You get licensed, and then you get the patient. Next, patients have the right to expect a safe and and high quality care. Safe and high. Two very important words. The care must be safe. All measures must be respected. And it must be high quality. Who is to make sure that the patient is safe? You. Who is to offer the high quality care? You. It is their right and it is your responsibility to perform. Next, patients have the right to receive care in a healthy, safe and secure environment that maintains essential hygiene, mandatory equipment, safe sterilization, smoke-free environment as per catalog. And that is why when you get home, when we are admitting a patient, we'll be asking about smoke detectors. Next, you are not going to be cleaning or washing the patient's dresses, but you are going to ensure that the environment is clean, the dresses are clean, and you are taking care and dressing the patient in a way that it should be. Are you understanding? So if there is something that happens, let's say I was doing treatment or feeding, and then the food fall, some particles might fall. It is my responsibility to get a broom and sweep. And if I am too busy, maybe doing something else, I should be nice enough to tell the housekeeping to help me clean it. Not keep the patient in bed, not keep the patient patient without changing, not doing the things that you are supposed to do. Keeping the patient, maintaining essential hygiene is the right of the patient and is the responsibility of the nurse. Patients have the right to receive care that is free from unethical behavior, abuse, or neglect. And that is why any of these three that you do, you will be facing the law. Is that understood? You are going to provide care within ethical boundaries. You are going to provide care that is free from abuse as well as free from neglect. And if you identify, let's say you are working a 12 on 6, and each time you come back on duty, you realize that something is not wrong, because each time you come, you meet a bruise, you meet a this of the patient. It is in your right to investigate what is going on with the patient and report to the appropriate quarters if that what you're suspecting is abuse and it is true. Not that you go blaming somebody for an abuse. You should investigate, you should make sure that it was not just a fall, it's not just a turn that has caused the bruise. Is that understood? And this is the right of the patient, and it is your responsibility. Patients have the right to be referred and transferred to another facility when medically required or upon patient's request, when medically permits it. If the patient is sick at home and the patient cannot get the necessary care, they have the right to be transferred to the hospital. But would they know when they will be transferring to the hospital? Would the patient know when it is necessary to be transferred to the hospital? How? You will be explaining. Now, the patient will not know when is the best time to go to the hospital because the patient is sick. You are the one to assess each day and all the time, and when you identify that the patient needs to be to the hospital, you will explain to the patient and to the family, and you will take the patient to the hospital. So it is the right of the patient to be taken to a hospital when you cannot care for them anymore, or when the facility that is being provided cannot accommodate the disease condition or the complication that has arisen. And that is your responsibility to identify. So if the patient is now hypoglycemic or hyperglycemic, losing consciousness and every other thing is going wrong, and you cannot manage it, you should be sending the patient to the hospital. How would they know that they need to go to the hospital? Nobody is with you, remember that. Okay. The next one, we have right for information. It is the right for the patient to understand all what they are suffering from, except against medical advice. And if it is against medical advice, it is in your responsibility to keep that information away from the patient. 2, it is in the right for the patient to understand in depth what is needed for them to be able to have a better health. And now we are talking about educating the patient about their disease condition, about the complications, about their medications, about everything, the lifestyle changes they need to incorporate, the dieting that they need to change, and everything that is going to help them to live a better life, either with the disease or to help them get cured from the disease. Does that make some sense? The patient as well has the right to get full information, one, about what? Any referrals that you are supposed to make, any changes in nurse or in procedures, any procedure that will be carried out. They need to understand that if or not they are able to cover the medical bills, if their insurance is going to cover, and for how long the treatment will take. So if I have to admit the patient now, the patient has the right to know if they will be in the hospital for 5 days, for 4 days, for 8 days, and to tell them this is how their financial obligations will look like, and if their insurance can cover or not. Is that understood? Okay. Next, they have the right to decision making. You are conducting and doing everything, and they are helping you to pick out the right decision. If my patient can speak, I should not just go to the wardrobe, remove a dress, and ask the patient to wear. If my patient can speak, I should remove the dress and ask the patient if this is what they want to wear for today. They take the decision. If the patient can speak, I should ask the patient when they will want to have their bath. If it's in the morning, if it's in the afternoon, if it's in the evening. Even when they have a standard time for taking their bath, like early in the morning, immediately they get up and take their bath, I should still ask them or still tell them that it's time for bathing if they will want to have their bath. The patient should have the right to take the decision on what they want to eat, on the time they want to ambulate, and every other thing that incorporates their care. Let them take those decisions. That is what we talk about autonomy. You don't take the decisions for them. You don't impose on them. You let them be active in the care that you want to do for them. Next, patient equally have the right to seek for a second opinion. And what does that mean? Let's say that the patient has been programmed for a hysterectomy. Okay? The patient has the right to know if they refuse a hysterectomy, is there another option that can solve the problem without necessarily taking out the whole of the uterus? And if there is an option, they should be given that option and they should make those decisions by themselves. Is that understood? Next, patient has the right for privacy and confidentiality. We cannot insist on this any longer because for everything you will do and for every step you will take, all what you'll be hearing is the privacy and confidentiality of the patient should be maintained. Complain. Patient has the right to complain. They have the right to say you did something that was not right and the belief that that should change. It does not mean that they are trying to kill you. They simply want you to do the next thing that is right. Patient has the right to tell you about something that it was, the services that you provided that they feel that was not well done. The family have the right to do it. It does not mean that because they complain, they are having a problem with you. People complain because they want someone or something to change. And if there is a reason for which you did this, the services in that manner, and if you feel that is correct, you can as well nicely explain to them that reason. but do not hold it against them because they complain. Is that correct? Patient's responsibility. Now, it is not just the fact that the patient has the rights, they equally have the responsibilities that they must carry out as patients. Okay? The first responsibility would be what? They have the responsibility to accept the care that you are offering. Let's say a patient has high alert medication, insulin, and you wanted to give the insulin and the patient said no. What would you do?
Their responsibility to explain what will happen.
You will explain to the patient the importance of taking the insulin and what will happen in case they do not take that insulin. If the patient continues to refuse, even though you've explained, what will you do?
We have the responsibility to make understand patient what will happen. Otherwise, we will discuss with family.
You will now discuss with the family and try to see that the decision maker intervenes in helping you to talk with the patient so they can take their treatment. If the family, the decision maker comes talk with the patient and the patient still refuses to take the medication, what will you do?
Choose something we do.
You've already taken a second option. What will you do? Do you know why I indicated a high alert medication? Because high alert medication has high risks if not taken. That is why I specifically said high alert medication. I did not say PRN. If it is a PRN and the patient refuses to take the medication and you see that you can let go, if you convince the patient and it does not go, okay. But what if it is a high alert medication? This patient is in a crossfire between life and death and they need to take this medication and they say no. You have to, I need you to speak.
We have to inform the responsibility person how patient will suffer like this. Highly alert for this patient.
Yes, and I already indicated you alerted the decision maker or the responsible individual and the patient says, I'm not taking.
Will inform the physician who's treating if they will explain.
If they will, the next person you will inform to is the supervisor. And what will happen after that? You will open an over. Have you ever heard of an over before? Alright. Mom Ira will take you with an over and they will tell you all the steps that has to do with an over. Okay? Alright. We have responsibility to accept treatment, responsibilities to go with the diagnosis and take all the steps to comply with the medical instructions. If they said, Mama, you have problems with your eye, you need to do eye surgery. If the patient refuses, there is nothing you can do. So this now becomes their responsibility to make sure that they comply with the services that are to be given to them. Next, information. Patients have the responsibility to give or provide information to the best of their knowledge and complete. So you cannot go to the patient you cannot go to the patient when the patient is not feeling well or is complaining of pain and something, and then you ask her what is wrong and she does not want to tell you what is wrong. It is in her responsibilities to explain to you all what is happening with her so that you can give her the best of care. Patients have the responsibility to ask questions if they do not understand any information or instructions of the healthcare personnel. It is their responsibility to ask you questions and get clarifications if they did not understand what you said. Now, if they don't understand and they say they do, which most of the times I feel you guys always just say, I understand when I don't, it is in your responsibility to deal with the consequences if you never ask the question. So it's the same way, if you are explaining something to the patient over and over again, and in this case it's a high alert medication, you pleaded, you've done everything that you can for the patient to take the medication and they refuse, you open a high alert, you open an offer and make a report. If something happens to the patient, you cannot be held responsible. Why? Because you spoke to the patient, you educated the patient on the effect and every other thing, you spoke to the care decision maker, and the decision maker came with you to talk with the patient. If the patient still refuses, after that the patient must take full responsibility if anything happens to him. Next, follow treatment plan. If the treatment plan says the patient has to take medication in the morning, in the afternoon, and in the evening, we are expecting that the patient should take the medication in 3 times. If the treatment says the medication has to be taken 2 times, we are expecting that 2 times in a day, which is 8 a.m. and 8 p.m., the patient should be accepting to take this medication. Not take it at 8 a.m. and refuse to take at 8 p.m. or take at 8 p.m. and refuse to take in the morning. Is that understood? If the patient has to be on mechanical ventilation, I am expecting the patient to cooperate and not pull out the oxygen from the oxygen mask. Alright? Patients have the right to informed consent in treatment decision. So if they have okay, let's say, for an example, the patient has to go in for surgery and they need to sign the consent. It's their responsibility to sign. It will be explained to them which is the responsibility of the health facility or of the nurse, but they have the responsibility to go ahead and sign. If they refuse to sign, there is nothing you or any other person can do. This will be their responsibility, and any consequences after which should be theirs. I am not saying that when you want to give medication to a patient and she refuses, and then you go open and over. No. It is a systematic, step-by-step explanation counseling, meeting the right person, step-by-step counseling, and if the patient keeps refusing, and after all the methods in which you take to inform this patient and to educate this patient about it, and the patient still refuses, then there is nothing you can do. You cannot force the patient to take. Remember, one of the rights of medication administration is that the patient has the right to refuse. However, as much as they have the right to refuse, there is equally a responsibility to be carried or shouldered if something happens. Next, respect for others. As much as you should give the patient the ultimate respect, they equally in their rights and their responsibilities should respect you and respect every other person that is caring for them. Does that mean that a patient will not say something because they are feeling pain? A time might come. A time might come that your patient might tell you that you are useless. A time might come that a patient will tell you that you have no knowledge of nursing. A time might come that a patient might tell you something that does not really go well with your stomach. I want you to calm down, digest it. If you need to throw tantrums, come throw them on me, not on the patient. Okay? Because the patient is already sick. When somebody is sick, when somebody is in pain, when somebody is having discomfort, they have the tendency of behaving like children. That does not mean that you who is healthy, you who is a reasonable individual should follow them and do the things that they did because they are in pain. Does that mean that this will not be handled? It would be handled, of course. If the patient is abusing their rights by hurting you, of course we are going to handle that. And we are equally going to make the patient understand the need for them to respect you and make sure that you be comfortable on your duty. But what I am saying is, you should not retaliate in any way. Is that understood? If a patient slaps you, if a patient throws things at you, you should be able to call me immediately. I was slapped by a patient. As much as you have no right to assault a patient has no right to assault you. Because you are there, because you are caring for them. They are the reason why you are there. So if they cannot equally respect you, then no, you cannot be in there. So when we feel that you are threatened in any way, we will take you out from the patient's home. Is that understood? So you don't be assaulted physically, emotionally, or psychologically, or sexually, and then you just sit quiet that, oh, it's a patient, and I do not have to do anything. You can do something, and that one thing is talk to me immediately, not after 2 weeks. You don't wait until the second time it happens, you now tell me you were taking care of Baba, and Baba grabbed your botox, or Baba grabbed your breast. No. You will tell me immediately it happened, and we will start solving it immediately. Is that understood? Next, keeping appointment. If a patient has an appointment in the hospital, it is your responsibility to make sure that you make all necessary arrangements for that appointment to be successful, including making schedules, including getting the car if there is no car, to getting the ambulance if there is no car, or making arrangement with the doctor or the decision maker to provide a car that will take you guys to the hospital. It is in the responsibilities of the patient to go with you for that appointment. If you prepare the patient, prepare all documentation, call the hospital and get the set time and everything is ready, on that moment that the patient says, I'm not going to the hospital, there is nothing you can do. Is that, or do you understand that? Next, when present at the health facility, patient must wait for their turn and be patient. Of course, they will not get to the hospital and they go straight to see the doctor and then they leave, right? There will be other patients that are either coming or have been waiting. Your patient must be patient enough to wait for their turn and not make it look like you have any kind of powers to make them get into the appointment immediately. Is that understood? But you should arrive on time so that you'll be able to go in on time. Because if you are late, your patient's appointment time might be over because you were not there. Is that understood? Financial obligations. The patient has the financial obligations to comply with all and timely payment. If they are not paying by themselves, you must make sure that their insurance is capable enough to pay the services that are being provided. You do not take the patient to the hospital and they do everything they have to do and then tell you to pay and the patient says, I cannot pay, the price is too much. You failed as a nurse because it is in your responsibility to make sure beforehand that the services you are going to, you can afford for it. And if you cannot afford for it, the insurance can cover that. Is that understood? Patients are equally responsible for providing, to the best of their knowledge, complete and accurate information about their insurance claim. So they will not just tell you, yes, my insurance can cover it. You should be able to confirm the fact that the insurance can cover a surgery, a cataracts, or medications, or whatever. Okay. As of now, this was just a short class, and this makes it the end for today. Okay, so you have gone through almost all my classes. When I will come back to class, I will only be coming with forms and forms and forms and forms for us to learn how to fill them, one after the other, until you have a complete lecture about forms with Ma'am Patricia. I will equally be coming to class at the end of your course when you're about to go for shadow, because we will take the course for endorsement, how you are supposed to do your endorsement, which type of endorsement you are supposed to do, when and how. Okay? Alright, do you have any questions for me? If you do not understand something and you go through something and you think that you want to ask questions, you are very free to come to my office and do that. And if there is a time that you are in distress and you need to talk to somebody or you need to ask questions, you need to have clarifications about something, my office is always open, you can come talk to me. Is that understood? Okay. As for now, I will send you the posters and the evaluation, and when you're done, you can go ahead and do the rest of the things you were supposed to do.
Thank you.
Thank you.